maternal health, child health does not fall into creeks. Of course, one of the most important things that has made us realize is the digital health and the value of reaching out to the women and to the communities in the absence of active services. So I would also place this call that the women healthcare and the self-care model which is being propagated during the COVID-19 should be made mandatory, having emergency contraception, DMPSC, which enables women to have those services, should be a part of ongoing services. And the health sector reforms, which means that having more accountability, involving communities, and my last would be about the public-private partnership. Sindh is lucky to have, and Sindh is really great in setting up a leadership of public-private partnership. Can we have family planning models also for public-private partnership, in which the PPHI kind of a model can be created for ensuring that we are able to combine innovation, risk-taking, and scale together. Thank you.
Thank you very much, ma'am. Very rightly pointed out that intersectoral collaboration, data visualization, and public-private partnership are very important components of advocacy and cannot be emphasized enough. My question to Dr. Nusrat would be, ma'am, what is your experience in postpartum family planning? And the second part of the question is, how can it be scaled up in other tertiary care hospitals?
Thank you very much.
Briefly.
For giving me this opportunity to share our experience at Civil Hospital. I think this was a very landmark decision of Government of Sindh for the first time that the biggest tertiary care hospital of Sindh was involved with this great intervention of postpartum family planning. I don't think it is happening anywhere else, and I think it's a great model that all public sector and even private sector, all universities where there's teaching and learning and clinical practice, wherever there is a labor room, this should be an intervention that should be replicated.
Correct.
So mostly this is a great success story, although there were lots of challenges, and there still are challenges, just like we all know that change is always very, very difficult. People don't want to change, and everybody is happy and comfortable as things are. So this story actually started, I think, in 2019, and this was Minister Sahiba's vision, because of this FP2030 program, basically, that Dr. Talib had come to Civil Hospital, actually, and he made this great effort. He met all the HODs, all the heads of Department of Gynecology and Obstetrics,
right.
And as well as he met the Vice Chancellor. He actually made the ground, he did all the groundwork, and not just government alone, there, just like Yasmin was saying, public-private partnership. So it was a great thing that private sector was involved, Pathfinder was involved, and NCMH was very closely involved in making our counseling corner, in giving us trained counselors 24/7, starting from the OPD, outpatient department, and then there was a counseling corner just outside the labor room where 24/7, morning, evening, night, even including Sundays. The trained girls, they were counseling each and every patient, and then once that patient goes into the labor room, then of course the doctors took up the job from there, and
yes.
We were providing postpartum family planning, the two most effective methods, long-acting methods, which included both PPIUCD as well as the implant.
Right.
So we did the training workshops, again with the help of the government, again with the help of NCMNH and Pathfinder, so that we made sure that all the girls were certified. They made a skills lab, actually, which was inaugurated by Dr. Talib. So I think that's a very good model, and that's a very successful model, although the challenges are always the greatest challenge, I think, that's of the counseling. Again, although we have counseling 24 hours, and our doctors are also counseling, but the quality of counseling, again, needs a lot of improvement in the quality and giving time. Because the greatest challenge is, again, the kind of patients that we get in Civil Hospital, the poorest of the poor, the totally uneducated women who have no power of decision,
Yes.
When you ask them about this family planning, they get scared. They think, why are doctors asking me this family planning? What is their motive? What is their agenda? And they can't make a decision. They always say that I have to go back home, apne shaur se puchungi, I have to ask my mother-in-law, I have to ask my husband. So those are the big challenges, and plus there are so many myths. Another great challenge is that so many myths and misconceptions, where they think that long-acting family planning methods are going to harm their uterus and they are going to get side effects. So again, it's all and we all need to create this counseling model in all the universities, in all the labor rooms, public sector, private sector, both.
Thank you. Thank you so much, ma'am. I really appreciate it. Dr. Zeb Dar, how has FPRH been integrated into PPHI services? And how issues, if any, are being addressed to streamline these services? Very briefly, please, because...
Yeah. So, as shared by Dr. Nusrat, that global evidence suggests that if there is a constellation of services, I mean, there are multiple options of services, especially for MNCH, like antenatal, delivery, postnatal, nutrition, and immunization, the woman is more likely to adopt family planning.
Yes.
And example is postpartum family planning. Postpartum family planning is effective, I mean adoption is effective when woman is counseled during antenatal period. So at PPHI, what we do, when woman comes for family plan, for antenatal care, we issue an antenatal card, and we have added one column on that card, which says if woman will deliver at the health facility, what method she will adopt at time of delivery, postpartum. So that column remain empty until the end of her fourth visit, because as Dr. Nusrat said, she need multiple consultation with her family members, husband and mother-in-law, etc. So by the time she comes for fourth or more than fourth antenatal visit, she actually decide herself for family planning.
Right.
So I mean, integrating family planning at the service, at the facilities where there are more MNCA services is very effective, and woman is more likely to decide, freely, and she more likely to continue that method for a longer time.
No, thank you very much. That was very comprehensive, yet brief answer. Dr. Tabinder, how have informed decision-making and women and girls' choices improved during the FP 2020 process? And before you start, may I ask the participants who have joined us on Zoom whether they can hear us or not?
Yes, we can hear you. Yes, we can hear you.
Okay, good.
Thank you to the government of Sindh and partners here for their robust commitment for the FP 2020 goals. I think that there are no two opinions that the government of Sindh has been making extraordinary commitment actions for FP 2020. On the Population Day, let's remind ourselves that population, sexual and reproductive health and rights, and our environment are deeply connected, and that women and girls bear a disproportionate burden of the repercussions of progress when it's slowed down in either of these sectors. FP 2020 mechanism in Sindh provided a much needed collaborative and leadership thrust towards the fulfillment of FP 2030 goals, FP 2020, now FP 2030, and that family planning is a human rights issue and a matter of voluntary choice.
Very true.
FP 2030 is a global partnership to empower women and girls. And let's try to see, taking a case in point, Pathfinder's partnership with the CIP to see what progress was made to incorporate women's needs and incorporate the concern for informed choice, as you say, Mohyuddin. So in the past 5 years through Naya Kadam, and before that, because Pathfinder is very proud to have partnered with the government of Sindh for the development of the costed implementation plan, something which became a movement in itself. Naya Kadam partnership with the government of Sindh helped the government institutionalize training modules that consider gender determinants on health and social determinants of health and conceptual clarity of the providers and counselors. So that was one thing. Another very important area for understanding women's choice and informing them is the work that was done with lady health workers, not just by Pathfinder, but with so many people over here. More than 7,500 LHWs in 3 different districts are now giving gender-sensitive counseling to patients. So that is one thing that came forward. I also wanted to say that the pre-service curricula, which is now going to be institutionalized for RTIs and midwifery, they now include modules on gender, humanitarian considerations, disability, people living with HIV. So obviously these are progress towards the FP2030 goals. Entrepreneurial skills needed in the private sector, for midwives to do community engagement was also facilitated by the government of Sindh in partnership. Last but not least, SPCC, Social Behavior Communication and Change for Women, messages were developed in partnership with the government. I'm happy to see Shahzad Roy in the audience. He produced a jingle under this partnership, which the government of Sindh institutionalized, and the messages on post-pregnancy services were also institutionalized. One last thing, and I think it's very relevant for the COVID-19 context, is that we saw that the incidences of gender-based violence and domestic violence increased. And once again, an initiative was taken by the government of Sindh to train providers on gender-based violence and to act as, first-line respondents. So this was a model, definitely a limited model, and I think the need of the day going towards FP2030 would be to scale all the best practices that are coming, to fore through certain models like this. Another thing that COVID-19 taught us is that for reaching out to women for informed choice, multiple media modalities and channels can be used. Digital spaces need to open up with safety and security safeguards for women and girls. So I'm just going to end here.
Thank you so much. The work has been rather impressive. Dr. Tanveer, my question to you is, how can family planning reproductive health be integrated into overall people's rights approach? And second part of my question is, how has HANDS integrated such an approach? Just very briefly.
Assalamu alaikum and good afternoon everyone. Thank you Dr. Mohyuddin for raising this question with me. Before understanding the people's health, how can we incorporate the rights of the reproductive health rights into the people's health movement, we need to understand the rights status of health and the RHFP in this country. All the conventions and all the declaration of UN where Pakistan has signed and Pakistan is signatory to it is clearly defining the rights of RHFP. Fortunately, on the other hand, being a member of the WHO signatory to all of declaration, Pakistan has failed to specifically recognize the right to health as the fundamental right as far as the constitution is concerned. So we should be very clear that our constitution doesn't cover this health as a basic human right. And unfortunately, right to health is nowhere found in the constitution, but in the Article 38